Did you know that just last week, a healthy 35-year-old marathon runner got blood test results showing dangerously high liver enzymes, triggering months of unnecessary medical tests and anxiety? The shocking truth? She'd simply done an intense workout the morning before her blood draw. This happens to millions of people every single day, and it's completely preventable. A groundbreaking 2023 study from Johns Hopkins analyzed over 500,000 blood test results and found that nearly 40% showed significant inaccuracies due to simple preparation mistakes that patients made in the 24 to 48 hours before their test. These weren't small variations either. We're talking about differences that led to misdiagnoses, unnecessary medications, and in some cases, completely missing serious health conditions. The most mind-blowing part? Every single one of these errors could have been avoided with basic knowledge that takes less than 10 minutes to understand. Your blood tells a story about your health, but that story can turn into complete fiction if you don't know these critical preparation steps. And here's what really got my attention when reviewing the research. Mistake number 2 on our list involves something 78% of people do wrong, and studies show it can alter your cholesterol readings by up to 25% and your blood sugar by even more, potentially leading to a diabetes diagnosis when you're actually perfectly healthy. Before we dive in, let us know in the comments now your age and where you're watching us from. We read and reply to every single comment, so drop your comments below now. Without any further ado, let's get started. Number 10. Not knowing which medications to stop. This mistake affects roughly 15% of all blood test results, according to a 2022 analysis published in Clinical Chemistry Journal. Yet hardly anyone talks about it. Many common medications and supplements can dramatically alter your blood test results in ways that have nothing to do with your actual health status. Take biotin, that popular hair and nail supplement millions of people take daily. Research from the Mayo Clinic found that biotin can cause falsely high or falsely low results in over 40 different blood tests, including thyroid hormones, vitamin D, and even cardiac markers used to diagnose heart attacks. One case study documented a woman who was nearly treated for a serious thyroid condition she didn't actually have, all because she was taking 10 milligrams of biotin daily for her hair. The interference happens because biotin is used in the actual laboratory testing process, and when you have extra biotin in your blood, it messes with the test mechanics. The solution is straightforward, but requires planning. Stop taking biotin supplements at least 72 hours before any blood test. For other supplements, like vitamin C, which can interfere with glucose and cholesterol tests, stopping 24 hours before is usually sufficient. Prescription medications are trickier because you should never stop them without consulting your doctor first. However, you absolutely need to tell your doctor about every single medication and supplement you're taking before the blood test is ordered. They might need to adjust the timing of your test or interpret the results differently based on what you're taking. Even something as innocent as taking aspirin for a headache can affect platelet function tests for up to a week afterward. The key is creating a complete list of everything you take, including occasional over-the-counter medications, and discussing it with your healthcare provider before scheduling the test. Now let's talk about a mistake that catches even health-conscious people off guard. Number 9. Testing at the wrong time of day. Your body operates on a 24-hour biological clock that affects virtually every substance measured in blood tests. Yet a study from the University of Chicago found that 62% of patients don't know this matters. Cortisol, the stress hormone, can vary by up to 50% throughout the day, being highest in the early morning and dropping to its lowest point around midnight. If you get your cortisol tested at 3 p.m. instead of 8 a.m., you might appear to have adrenal insufficiency when your adrenals are actually working perfectly fine. Testosterone follows a similar pattern, with levels in men being up to 35% higher in the morning compared to evening. A 2021 study of 5,000 men found that those tested in the afternoon were twice as likely to be diagnosed with low testosterone compared to those tested in the morning, even when their actual hormone production was identical. Iron levels also fluctuate significantly, typically being 30% higher in the morning. Even your white blood cell count changes throughout the day, increasing by about 25% from morning to evening in healthy individuals. The solution is to always schedule blood tests for the same time of day if you're tracking changes over time, and preferably aim for morning appointments between 7 a.m. and 10 a.m. when most reference ranges are established. If you're getting hormone tests, especially testosterone or cortisol, morning testing is absolutely essential for accurate results. When you can't get a morning appointment, make sure to note the time of your blood draw and mention it to your doctor, as they may need to interpret the results differently based on what you're taking. Even something inventive, a study that found most protein measures were higher when people walked before their test than when sitting quietly for 15 minutes. A 2023 study documented cases where patients were prescribed unnecessary heart medications for high potassium levels that were actually just artifacts from fist pumping during collection. The arm position matters too. Having your arm hanging down versus supported at heart level can change blood pressure readings by 10 points and affect the concentration of various blood components by 3 to 5%. The best practice is to arrive at the lab early and sit quietly for at least 15 minutes before collection. Keep your arm relaxed and supported at heart level during the draw. Don't pump your fist unless specifically asked to, and even then, only do it minimally to make veins visible. If you need to walk a long distance to the lab, factor in extra sitting time before collection for the most accurate results, especially for protein and cell count tests. Maintain the same position for at least 15 minutes before blood is drawn. Next is a mistake that even many healthcare workers don't fully understand. Number 3, getting blood from the wrong arm. If you've had any medical procedures or have an IV in one arm, getting blood drawn from that same arm can completely invalidate your test results. A shocking investigation from the Centers for Disease Control found that up to 10% of abnormal blood test results in hospital settings were actually due to contamination from IV fluids rather than true patient values. When you have an IV running, even in a different vein in the same arm, the fluids can leak into surrounding tissues and then get pulled into the blood sample. One documented case showed a patient's glucose reading at 450, indicating severe diabetes when their actual blood sugar was a normal 95, all because the blood was drawn from the same arm as a dextrose IV. The issue extends beyond current IVs too. If you've had a recent injection, vaccination, or even a contrast dye for imaging in one arm, that arm should be avoided for blood draws for at least 24 to 48 hours. A 2022 study found that blood drawn from recently vaccinated arms showed inflammatory markers up to 200% higher than blood from the opposite arm, potentially indicating serious inflammation that was actually just a local reaction. Even having blood pressure taken repeatedly on one arm can temporarily alter the blood composition in that limb through pressure changes and mild tissue trauma. The solution is simple, but requires you to be proactive. Always inform the phlebotomist about any recent procedures, injections, or IVs in either arm. If you've had lymph nodes removed from one armpit, typically during breast cancer treatment, that arm should never be used for blood draws as it can cause lymphedema. When possible, use your non-dominant arm for blood draws to minimize movement artifacts. If both arms have had recent procedures, ask about alternative sites or postponing the blood test until one arm has fully recovered. Now for the second most critical mistake that most people make. Number 2, eating the wrong foods 24 hours before. This is the mistake that studies show 78% of people make, and it's absolutely wrecking their blood test accuracy. Even when you're not required to fast, what you eat in the 24 hours before your blood test massively impacts your results. A landmark 2023 study from Stanford University followed 1,500 patients and found that eating fatty foods within 24 hours of blood tests increased triglyceride readings by an average of 25%, with some patients showing increases up to 40%. Even more shocking, the study found that high-fat meals could make your blood so lipemic, meaning full of fat particles, that it actually interferes with the laboratory equipment's ability to analyze other components accurately. Imagine being diagnosed with high cholesterol and prescribed statins for life when you just had pizza and ice cream the night before your test. But it's not just about fat. Eating red meat within 24 hours can spike your creatinine levels by 30%, potentially indicating kidney problems that don't exist. A fascinating case study documented a bodybuilder who ate 2 pounds of steak a night before his blood test and showed kidney function markers suggesting stage 2 kidney disease. But when retested after avoiding meat for 48 hours, his kidneys were perfectly healthy. Sugar is another massive culprit. Consuming sugary foods or drinks within 12 hours of testing can elevate your fasting glucose by 15 to 20 points, enough to push you from normal into pre-diabetic range. Even artificial sweeteners can trigger insulin responses that affect multiple blood markers. Coffee, even black coffee during a fast, can increase cortisol by 25% and affect liver enzymes. The optimal approach is to eat light, balanced meals with moderate amounts of lean protein, vegetables, and whole grains for 24 hours before testing. Avoid fried foods, fatty meats, sugary treats, and alcohol completely if you're getting cholesterol or triglyceride tests. Some experts recommend eating your typical diet for 2 weeks before testing to get accurate baseline results, then avoiding all high-fat foods for the final 24 hours. Keep a food diary for the day before your test and bring it to your appointment, as it can help your doctor interpret any unusual results. And now for the number one